Mm-hmm. Thank you very much, our viewers, for this opportunity again. You've taken time to listen to our interviews. We've done a couple of documentaries, and we are continuing to inform the community, especially in the diaspora, on how we can progress as a community, how we can move ahead as a community, and how we can even pull our resources together so that we can ensure that our country or our nation, whether back in Africa, let me say our continent, and then the continental America, where most of our people, especially from the African immigrant, actually stay. Today, we are bringing you a very prolific community member, Mr. Henry Momanyi, who is a celebrated Kenyan, who has actually done a lot of work, especially in community organization and community mobilizations in different areas. He's also an expert in community engagement. He has really done a lot of engaging the community, especially in trying to ensure that they get, they are healthy, and by extension, even trying to bring people or professionals who can give clear guidance on how to have a better life. So today, we are bringing him in to tell us a little bit more about how they are trying to tackle the AIDS pandemic. Bwana Henry Momanyi, how are you doing today?
I'm fine, Mr. Ben. Good evening.
Thank you very much. So we are going to briefly discuss on modalities and ways of combating or preventing AIDS virus or HIV now as a disease. So before we start the conversation, we would like you to have a 10-second introduction or give your, give our viewers your bio. Go ahead, Bwana Momanyi.
Well, thank you so much. Good evening, ladies and gentlemen, viewers who are watching this program this night. I will start by thanking Mr. Ben Kebwato, the director of KDR TV, for this wonderful opportunity once again to continue with our series on educating the community on HIV and AIDS. My name is Henry Momanyi. I'm the executive director of Global Health Services. We are located in Brooklyn Park. And Global Health Services has been doing this work of the community in outreach and early intervention services for the last 17 years or so. So tonight we are here to focus on HIV and AIDS and how it is impacting our community, especially the immigrant communities who are in Minnesota. Thank you.
Thank you very much, Mr. Momanyi. Let's go straight to the AIDS virus or pandemic. I'll request my director to bring us together on the screen so that when I'm asking you the question, I'm actually looking at you directly. Thank you very much. So, Mr. Momanyi, what is HIV?
Yeah, HIV is a human immunodeficiency virus, and this is the virus that causes AIDS.
Thank you very much. Very brief. So what body fluids do not transmit HIV? And the reverse is also true. Go ahead.
Thank you so much, Mr. Kebwato, for that question again. There are some body fluids that they transmit HIV and AIDS. These are semen, blood, and anything that, comes into, contact with, sexual intercourse or end opening. The fluid that can pass through even blood transfusion, these are the ones that can transmit HIV and AIDS.
Thank you very much. Go
Ones
ahead.
that can
Go ahead.
are saliva, mucus, something. Yeah, you can name it all.
Thank you very much. Is HIV easily transmitted?
The answer is yes and no.
Mm-hmm.
Yes, because if you don't use the universal precautions, you can easily contact HIV and AIDS. HIV is easily transmitted when you don't follow the universal transmission precautions that are laid out there. What causes or how can somebody get infected? When unprotected sex, when you come into contact with HIV fruits, when you have annual sex, that is sex normally which is done between men who do sex with men, without protection. Is it preventable? Yes. That's why we say it can be protected. You use the condom, of course, you cannot get infected with HIV and AIDS. So HIV can easily be transmitted, and HIV can easily be protected from being transmitted or infected to other people.
Thank you very much, Mr. Momanyi. Let's also a little bit dig deeper and look at some of the scientific innovations which is really out here. Already it's been tested, and they say 70 to 78% risk-free. And again, not really risk-free, but it can really make sure that somebody cannot contract this particular disease. It's over 70% rate, success rate. So, what is PEP and PrEP?
PrEP, PEP is post-exposure, and PrEP is prophylaxis. And this is nothing other than the medication that somebody who has got HIV infection takes like every morning. It takes a pill like the women take morning after pill. It is proven that whenever you take it, it can protect you from transmitting HIV to your partner. So that one is assured, and we want to encourage our people that please, if you know that you are infected with HIV and AIDS, please go and see your care provider, because that's where it is. After that, then you will the services that from transmitting this HIV and AIDS to your partner or to other people, you see. And HIV is something that can be taken care of. It's not that people live with HIV for the last 40, 45 years, and they are doing work as normal. So it starts, and that's what we're trying to encourage our people. Please get tested first, and from there, other things will follow. When you know your status, you can't go wrong.
Thank you very much, Mr. Momanyi. And how long does it take for HIV to develop into AIDS?
Well, that one, it needs a medical, expertise, but I know when you are tested earlier and your status is detected earlier, they can, prevent it from becoming HIV and AIDS. Because when we talk about HIV turning to AIDS, that means the virus which causes AIDS. That is, HIV is a virus which causes AIDS. And what is AIDS? Immunodeficiency virus. That means once now the virus has been attacking you without your knowing what's going on, when it is discovered at the later stage, when it has turned to AIDS, that means your immune system has been compromised. So it depends from one person to another. That's why I'm saying this needs now a more professional expert to explain how long it takes.
Thank you very much. So is HIV/AIDS a death sentence?
It is never a death sentence. The thing is that we encourage our people, please, everybody is vulnerable. Anybody can get HIV at any time, if only you are not what? following the universal precautions. Again, protect the sex using condoms in the right way. You see, using gloves, when you are coming into fluids, some transmit HIV and AIDS. So it is protected. You can yourself. AIDS, you cannot get it. But if you get it, again, it's not a death sentence. You can live as long as it takes, provided you follow your doctor's word. Universal precaution that you are given by your provider.
Thank you very much, Mr. Momanyi. Now, let's also take you a little bit further and ask you a general question. I mean, why should somebody get tested? Why? I mean, why? Why should we be tested for HIV and AIDS?
Thank you. That's a very good question. It is better for everybody to know his health status or health scorecard. It's not even about HIV itself. There are other diseases which are even more deadly than HIV and AIDS. For example, cancer, you name them, It is good to know your scorecard, your health scorecard. So whenever you are tested, it means you are trying to know how is your body, how is your health. And they detect that you have got HIV and AIDS, and they detect it earlier, then you are safe because you will be put into medical care and you can live as long as it takes. It is good to get tested earlier, know your status, so that now you can plan your life knowing what you do, when you do it, and you can be there as long as it takes.
Thank you very much for answering that question. So let's go again and discuss a little bit more about your community engagement, ensuring that the African immigrant get help. How do you, let's start from your company. How does your company help the African immigrants to ensure that they get tested, they get if they are positive, they are referred to their medical professionals for help? That is the first question. Then the last question should be, do we have other African immigrant affiliate organizations which can help the immigrants themselves on how to ensure that they can get help to prevent or to treat HIV and AIDS?
Thank you. Thank you so much for that wonderful question, Mr. Kibwat again. My agency or organization is called Global Health Services. It's been in the system or been working for the last 17 years, I can say, because we started working since 2007. We specialize in early intervention and outreach services. It means is we get the information, we bring it try to recruit people, encourage people, bring the resources which are not there, and encourage our people that there are resources here, advantage of it. And since we started doing it, it started slowly. There were some challenges here and there, but again, at the moment now, I can say we have taken off. We are known all over. We know our clients, our customers know exactly where the services that we give, where they are. We get some calls, and again, people come and get the resources that they need, which I am very happy that and proud of that. We are doing a great job in the community. In the side of the other affiliate sister agencies, yes, I can say we have our African sister agencies that they do HIV and AIDS. We have like Sub-Saharan African Youth and Family Services, which is in St. Paul. And I think, as at now, I can say, with no doubt, that they are much well placed resource-wise. They are doing a very good job when it comes to HIV and AIDS, as at now. And I can say it's one of the agencies that I'm proud of, because they have got enough resources that they have, other small agencies whenever they need some, help. So I'm proud of them, and I want to encourage them that, please do keep doing what you are doing. And I think on HIV and AIDS, you are doing a fantastic job. And mine is the Global Health Services, one of the agencies also, which we partner with Sub-Saharan Africa, Youth and the Family Services, and the KDRE TV, the one that now is hosting us in this dialogue tonight. KDRE TV, please keep doing what you are doing, because you bring important information to our people, wherever they are, families, wherever they are. You know, like now, our families are watching and they are getting information that they could not be able to get it from anywhere. So these are the agencies that I know when it comes to HIV and AIDS, which are surviving because after the COVID-19, HIV, you know, HIV AIDS providers, some of them have gone down. Some of them, they are not even working because resources was transferred. They were given to other agencies that do or fight COVID-19. Right now, we are having a big problem when it comes to fund, and I'm trying to appeal to our funders that the HIV is there. HIV actually has gone up triple. But again, we don't know what the providers or the funders are doing because I don't think they are keeping it, you know, as an important area that they also want to provide or fund.
Thank you. Thank you very much, Mr. Momanyi. Because of time, we are going to finish or end here, but we'll continue having a discussion, maybe monthly or bi-monthly, so that we can be informing our community on the AIDS pandemic or any other emerging diseases and many other informations which we might be having or will be brought on our tables or through emails, through contacting us, so that we can continue deliberating on this, on pertinent issues affecting the African immigrant community. And I also graciously thank you because it was not possible for us to get you today. You are a little bit busy. Even right now, you know, people might be wondering where is Momanyi, an executive director of Global Health Services, in a mattress farm or shop. Thank you very much. That is, I mean, Mr. Momanyi works on in that particular shop, is a partner to that shop there. One of these fine days, we'll definitely send our people to go and do a documentary on the wonderful business aspect our African community guys are doing, like Mr. Momanyi and his friend there. We might not actually bring him today so that you can see him, but later on, we'll try our level best to bring him. So, till next time, Mr. Momanyi, thank you, and may God bless you for accepting to be interviewed, even if you are given a short notice. Thank you. May God bless you.
Thank you. Thank you so much, Mr. Keboto, for...